Today we're just going to be presenting on strategies to getting public health services to underserved communities as a chiropractor and some different ideas of things that you can do. So hopefully from this presentation you guys will get a couple ideas that maybe you could go take into practice with you in a way that we can get out and help people who really don't get our care very often. So first, it's really important that we define what an underserved community is, or what types of people are in those communities. So our definition of that is a couple of things. First, it could be people of low socioeconomic status who may not be able to normally afford our care, because sometimes our care isn't always covered by insurance, and sometimes we have cash practice, and there's a lot of people out there who can't really afford that. But then we've also taken a look at it more in a physical and mental way. So there's people who have physical disabilities who may not be able to get to our office, people who have mental disability, and then we also have patients who may be unable to leave the hospital and are unable to get our care that way. There's not very many venues for people to get chiropractic care in hospitals who are there for long-term periods of time unless we go to them. So further on in our presentation, we're going to be talking about maybe a way for you to be able to go and do that. So, and this is a big question, so why is it really relevant for chiropractors to want to get into underserved communities? So I kind of thought about that, and I kind of came up with like 3 main things that I thought about why it's relevant for us. Morally, I think it's important that we fight the stigma that chiropractors aren't really real doctors. I think that a lot of times we always get stuck with like the quackopractor stigma, which is true. I mean, and it's not true as in like we actually are fake doctors, but a lot of people think that. And I think a great way to be able to fight that stigma is for us to go out and prove that we're serving people that, you know, the rest of the health community's kind of forgotten about. And I think it would be really good PR for us in a way to change that stigma and say, well, wow, my chiropractor is, you know, down and helping these people, and I'm like, why isn't my medical doctor doing that? Well, we care a little more. So keep it simple. And then annual cost of healthcare. In 2014, it was shown that the taxpayer paid about $431 billion in 2014 just in Medicaid. As you know, that chiropractic was kind of like, well, it's becoming more generally known, but and the insurance companies have realized this for a long time, that we decrease the cost of healthcare. So that's another venue about why this is important for us to go out and promote ourselves. And then third of all, I think it's important for new patient attraction. I think patients would really appreciate having a doctor who's more connected into the community, more helpful to everyone in the area. I just think that's something that people would be proud of and want to go to more towards. So I'm just going to give you kind of a little basic overview, and then we're going to go into some more details about some of these ideas. So you can do pro bono work. So we have a couple ideas. We have the Salvation Army and Red Cross, which we're going to talk about. You could treat for free in your practice, which so like some of the other groups talked about, has its pros, has its cons, and has its risks. So that's up to you. You could treat the Pillsbury House, service trips, and then we'll also be talking about maybe some ideas for you to be able to talk about in community centers or low-income areas, some good health talks. And then we'll be talking about some ways you can get to maybe do some promotional events that might generate charitable revenue. Charitable revenue. Oh my gosh, what am I doing this morning? Ways that you can give money to charity if you're doing your work, which is always nice. And then lastly, if you're going to be big on supplement sales, maybe you could donate a piece of your supplement sales to a charity. So you could say like 10% of whatever I'm selling for omega-3s this month is going to cancer research, or is going to this public health venue, whatever that may be in your general area. So, like I said, we have the Red Cross, Pillsbury House, service trips, dedicated pro bono treatment days, and then we're just going to be going over a couple of different health talks that you could probably do. So, I'm going to hand it off.
So, at this point, you're probably wondering what are some of the options for you guys as students and then future doctors to participate within the community. And one of the big things that I'm sure a lot of you have heard about is Salvation Army, as well as maybe you have talked to Upper Tri, as well as I have, and just heard really good things about working at Salvation Army, just dealing with all walks of life and getting to hang out with Dr. Novak. So all students are eligible to help with Salvation Army starting in T7, so not too far from now. And those hours spent there will go towards our clinic hours, which is really nice. The hours are available though, first come, first serve. So if you do have a very deep interest in it, it might be good to start thinking about it now and maybe talking to Dr. Novak about any questions or what you need to do. And obviously, as posted, if you'd like to contact him, we have his contact information, as well as any other questions, you can go to the clinical education office downstairs. Another option we thought about was health screenings. They're a really good way to reach out to a broad variety of people, I would say. First and foremost, we really thought about our youth in our communities, so that's why we wanted to do free or discounted physicals for middle and high school age students. And then to even further think into that, we thought about baseline concussion testing, just because a lot of middle school and high school students are involved in one to multiple sports at a time. We also thought about free vital checks at churches and soup kitchens, and postural analysis checks, which can be done at a lot of different places. I've seen them done at malls, at community centers, things like that. Lastly, something that some people might not always think about is doing house calls. Being a chiropractor who takes house calls can be beneficial for a wide variety of people. A lot of people don't have the access or able to physically get into clinics sometimes. So we want to reach out to our mentally handicapped, our physically handicapped, those that might have infectious diseases, and there are some people that are in such excruciating pain that it does make it difficult for them to come in.
So now that we talked a little bit more about the handicaps to accessing care, now we're going to talk a little bit more about the issue of socioeconomic status in care. You can provide free health talks and brochures in your clinic or at community centers in underserved areas on the following issues: posture, exercise, nutrition, sleep, hydration, and stress management. And actually, it would be very, very beneficial to go into schools, because the literature shows that in adolescent years, such as middle school and high school, that there's less of a disparity gap between those of lower socioeconomic status and those of higher socioeconomic status. So why talk about posture and the following topics? Because we wanted to give people things that they can do in their home. If you're of low socioeconomic status, you may not be able to afford to come to the chiropractor. So all of these topics you can implement in your home on your own. Posture, we had a group that talked in Dr. T's P&P class about how posture can affect your mood, can even affect your immune system. And it's shown that slumped posture is associated with a negative attitude, but by sitting upright, you can increase your mood. Exercise is important. In a couple of studies that I looked at, exercise lowers COX-2, which is an inflammatory mediator. So you wouldn't tell your patient about that, but it could help your patients who have things like arthritis and things like that to reduce their inflammation in a natural way. And then exercise also in Parkinson's patients. This is just an example of disease care, but in Parkinson's patients, riding on a bicycle actually increased stride length and lowered the festinating gait. So that's a good one. And nutrition is an important topic. Obviously, people with barriers due to socioeconomic status may not be able to implement some of your nutrition advice, but you can provide them with ideas that they can slowly implement if it's viable for them. Sleep is another one that is obviously a free thing that you can provide help with. You can give them sleeping tips, things like that. Hydration is another thing that's obviously your water bill costs money, but it's essentially free in some areas. I know in other areas there are issues with the water supply, but and then stress management. So on this slide, we talk about the free care day and the sliding pay scale and why that is important. And the reason why it's important to have things in place to people of low socioeconomic status is because it has shown in research that as early as the 12th century, those of low socioeconomic status were more likely to die young and have higher mortality rates at a younger age. And because there's an article in the Annuals of Internal Medicine that's literally entitled that the key to eliminating socioeconomic status disparities in healthcare is access. So how can we help these people who may not afford it have access to care? And access to care may not even be these people's first concern. They may be homeless, they may not have access to food, and obviously those are first concerns to care. So what can you do? You can do a free care day. Free will donations or free care day are both viable options. It's nice because it's one full day dedicated to service, but some cons of it is that it doesn't always affect or help the people that you intended it to, and it may imply to some people that you don't value work since you're giving your services away for free. A sliding pay scale is also a good option. Patients pay based upon their income or tax bracket. But some cons are that you may have days or weeks where you make less money than desired or projected. And then finally, a third option that's kind of in between the two is a pay-as-you-go plan. And so you may provide discounted care on the day of, but have time throughout the week or throughout the month, like people who get paid every other week, they can pay after they get paid. But then a con of that is that collections then fall back on you and you have to keep those people current. So charitable donations, one way to help others, as Patrick talked about previously, is a charitable donation. Pictured is the 5-hour energy that gives a percentage of its, donates a percentage of its profits to breast cancer. And then health promotional events, which we talk a little bit more about on the next page, are a good way to raise the money for the public and promote your clinic and promote public health. So what can you do? You could do an amazing race. You get teams from the community and you make the locations all at public health related buildings or public health related areas. You could have a stop at a farmer's market, at your chiropractic office, and then at like a Planned Parenthood. A 5K fun run, you could do it in October since October is Chiropractic Awareness Month, and then take your proceeds and donate it to operating free clinics or discounted clinics and chiropractic research. You could do an online limited time fundraiser on your website and just donate the money purely to the charity, and the doctor can choose to match the donations that patients make on their website. And then finally, a raffle. You can do a 50-50 raffle. A 50-50 raffle is just people enter money into the raffle and get a raffle ticket, and then half of the money would go to the person who wins and half of the money would get donated to a charity. And then finally, by individuals who encourage a lot of wellness visits and referrals could get entered into a raffle as well. And then, because that encourages other people that may not be able to afford care to come in and get treated. So, yeah.